Hi, my name is Julia Allshouse. I'm a student physical therapist assistant, and today I'll be talking to you about the relationship between physical therapy and patients with HIV. The topics I will be discussing are what is HIV and its effects on the body, an exercise study that I found, exercise programs for HIV patients, and its relationship to physical therapy. So, what is HIV? HIV is the human immunodeficiency virus. It can be transferred through unprotected sex, shared needles, exposure to contaminated blood or urine, and from a mother to a child through pregnancy, childbirth, or breastfeeding. If left untreated or if one is not compliant with medications, it can also lead to AIDS. One major effect HIV has on the body is that the immune system begins to shut down and the body's organs begin to deteriorate. Age, gender, race, sex, and class do not play a factor in the transferring of HIV. Anyone can contract it. A study that I found called Aerobic Exercise Effects on Parameters Related to Fatigue, Dyspnea, Weight, and Body Composition in HIV-infected adults was completed to examine the effects of aerobic exercise on physiological fatigue, dyspnea, weight, and body composition changes in HIV-1 adults. The study included 60 HIV-1 infected adults. There was 52 males and 8 females. Some conditions for participation in the study included that the patient must be on and compliant with antiretroviral medications. They cannot be on any anabolic steroids, growth hormones, or appetite stimulants. Cannot have any AIDS-defining illnesses, fever, active wasting, or weight loss. And also, the females could not be pregnant. The sample was randomized into 2 groups. Each group contained 4 females. The experimental group were put into an aerobic exercise training program. The program was 3 times a week for 12 weeks, and the participants were under very close supervision. On the other hand, the control group was contacted every other week and did not participate in the exercise program until the end of week 12. The whole experiment lasted about 24 weeks. This chart shows the averages of certain parameters of the experiment. It is a little blurry, but you can look closer on page 5 of the study handout. The mean age for the experimental group was 36, and the mean age for the control group was 35. Average time since the patients were diagnosed was about 4 years for both groups, and body composition, or BMI, was 27. The average CD4 count for the experimental group was 328, and for the control group, it was 357. Measurements used in this study to collect data included time on the treadmill, which measured physiological fatigue, rate of perceived exertion, or the Borg scale, for dyspnea, weight in kilograms, body composition, or BMI, and CD4 counts, which were found through blood draws. Other descriptive variables included fitness activity checklist, a 4-day food diary, which was filled out before the experiment began to see how the patients were eating already, and an HIV symptoms chart. The results of the study were as followed. 49 completed the study, 19 experimental, and 30 control. The CD4 counts were not affected by the study or the exercise program. So this table is on page 6 of the handout. This table shows the results in the changes of certain parameters during the experiment. Some of them include time on the treadmill, which was measured in minutes. For the experimental group, increased by 1 minute, and for the control, it only increased to 0.2 minutes. The rate of perceived exertion for the experimental group had no change, but the control actually decreased by 1 point, which actually surprised me. Weight weight in kilograms for the experimental group decreased by 1 kilogram, and the control group increased by 1 kilogram. Also, the CD4 counts did not change. Reasons people did not complete the study were attributed to employment, change in schedule, transportation, family crisis, the length of the study, but none were attributed to new illnesses. My opinion? I think this study was good overall, but there wasn't an even balance between the males and the females. It was also a small sample size, especially because HIV affects so many in our community, and it's actually a higher number than most people would think. Also, the majority age of the participants was in their 30s. And also, it was a little bit of a long study, so they lost 11 participants. I really think it should be redone either soon or in the near future, especially with all the new medical advancements that deal with HIV and possibly finding a cure soon. I think it should be redone and see if it changes at all now. Although physical therapists do not treat the disease directly, they play an important role in treating conditions that limit the person's movement and function. A physical therapist's overall job is to improve the patient's quality of life and help keep them active in their roles at home, work, and in the community. Things physical therapists can do include pain relief, reduction of muscle atrophy or muscle loss, regulatory of bowels by strengthening the pelvic floor, enhance the immune system, increase balance, cardiovascular system, pulmonary function, and endurance. Also, help prevent pneumonia and other respiratory infections associated with HIV. And last but not least, reduce anxiety and increase mood. Who doesn't feel better after a good workout? So what does the literature say about exercise? The literature that I read stated exercising for at least 20 minutes 3 times a week for 5 weeks may lead to a significant improvement in cardiopulmonary fitness, body composition, and psychological status. It is beneficial for medically stable adults living with HIV. And it also doesn't increase the occurrence of opportunistic infections that usually pop up because of the suffering immune system. HIV wears down the body. We all know this. But fatigue is the biggest complaint among patients with HIV. Most found that increasing an exercise program can also decrease the fatigue in a patient. These are just some standard precautions that one should take when working with patients with HIV. Use protective barriers, gloves, glasses, gowns when handling blood, body fluids, and infectious fluids. This is mostly seen in the inpatient setting because a lot of them are on so many medications they can't control themselves. But also, we need to wash our hands, not only for our sake, but for the patient's sake too, because we don't know what we're bringing in. Prevent needle and scalpel sticks. Use ventilation devices for resuscitation if you have to give somebody CPR. And do not treat a patient with HIV or AIDS if you have open wounds. It just makes you more susceptible. And also, if you're pregnant, take extra precautions. I appreciate you watching my slideshow. If you have any questions, feel free to contact me. Thank you.